bone radiology. Well, we saw some bones before. You won't get asked to show too much bone radiology. These are rib films. See the fracture of the ribs over here? The rib films? Well, those fracture of the ribs and the rib films there, this is just to show you the major management of rib fractures is analgesia. The major management of the rib fracture is analgesia because rib fractures, pain meds, because you cannot put a cast on someone's ribs. So the major management for rib fractures is analgesics to prevent the splinting that will cause pneumonia. If you have rib fractures and you don't breathe, you're going to breathe on one side of your lungs, you're not going to breathe on the other, you're going to get atelectasis, and you're going to get a pneumonia. The major management of rib fractures is analgesics so you don't splint and cause a pneumonia. This is a picture that Helen Keller could read. This is a feel-good picture. This is, yeah, I'm smart. I learned something in medical school. Yeah, there's a fracture there. Yeah, that's it. So this is simply a fractured arm. And this is a spiral fracture of the arm. Get me an orthopedic surgeon. Well, even if you never saw what this was and can't figure it out, why else would anybody show you an x-ray of a big toe? Why do they give you an x-ray of a big toe? Ask any random person. Why are they giving you a big toe x-ray? Gout. Oh, I don't even see anything in there. For all I know, this is urethritis and cystitis. I don't know. I can't see anything. Yes, but it's an x-ray of a big toe. And what you see here, well, I'll give you two answers. One, if they show you a big toe x-ray, just say gout. Two, the real answer. You see how this bone that is chopped out, chewed out, there's dark areas in there, chopped out, chewed out. Look at these bones. Look at these phalanges. Smooth, even, uniform. No dark holes in there. No dark holes. No dark holes in any of this. No dark holes. There's no dark holes. But here there's dark holes inside the bone. This is podagra. This is gout of the great toe. Get me some colchicine. Get me some allopurinol if it's not acute. This is chopped out bone lesions of the great toe. See, smooth, smooth, even, smooth, chopped out black areas, dark areas, podagra. This is very difficult. This next slide, I don't expect you to understand, but it is the best initial test for this disease. It is the first abnormality in a person who has, you see this thin white wavy stuff? You see the thin white wavy stuff? Here's the bone, here's the muscle, here's the bone, here's the muscle, bone, muscle, bone, muscle, bone, muscle, bone, muscle. What's this? Oops, it's me going onto the wrong image. What's this? It is periosteal elevation. This is the best initial test for osteomyelitis. Osteomyelitis of the lower extremity. Periosteal elevation. Normally the periosteum, look here, normally the periosteum should be adherent to the body. The periosteum should be stuck on there, covering it like a tight shirt. When you have disease, the periosteum lifts up and loosens up and comes off of the body. Periosteal elevation. There's pus coming off there. Pus coming off the surface of the bone, lifting up the periosteum. Periosteal elevation. Purulent material getting caught underneath the bone. And underneath the periosteum, lifting up with the pus, the periosteum. Periosteal elevation. However, the most accurate test for osteomyelitis is not the MRI. This is an MRI of osteomyelitis showing you osteomyelitis in the same person. However, no matter how accurate that MRI is, it's not as accurate as a bone biopsy. Why don't you say it for change? the radiology test. You have achieved enlightenment. Satyam Shivam Sundaram. It is not the most accurate, because even though I see periosteal elevation, even though I see osteomyelitis in the MRI, I need a bone biopsy. The reason that that bone is lighting up is because the swelling of the bone changes water density. The CAT scan is based upon calcium content. You have to lose 70%. You have to lose greater than 70% of the calcium in order for the X-ray or the CT to become abnormal. It's based on calcium content. That takes usually 2 weeks. Now the MRI is different. It's not just based on density of bone or tissue. It's not in the brain based on loss of the cells dropping out. MRI is based on the content of water. Molecules have a particular spin. They have a spin, those hydrogen molecules. They have a particular spin. And in the MRI, when exposed to different wavelengths of magnetism, they flip. And in one sense, you could say it's now, might be spinning the other way. It actually flips the molecule. And that flip and the amount of the ability of the magnetic energy to cause a different spin and flip of the molecule is not based on calcium content or actual density. It's based on content of water. Osteomyelitis takes weeks for the calcium to demineralize the bone. However, the cells swell. I know this sounds strange for bone, but osteocytes actually can swell. They can enlarge. And you actually can get swelling of the bone. And the osteocytes actually can swell up with increased water content, and that's what we see in this image. The white stuff that we see here is increased water content of the bone from swelling. And therefore, the MRI becomes visible at 1 to 2 days. Now, that is an equal sensitivity to a technetium pyrophosphate bone scan. Except the difference is that the technetium pyrophosphate bone scan will light up with any inflammation, and compared to a MRI, which has enormous specificity, meaning MRIs and bone scans will have the same sensitivity. Negative MRI, no osteo. Negative bone scan, no osteo. It's very sensitive. The bone scan has a hard time telling between soft tissue infection and bone infection because the images is based on uptake of radioisotopes of nuclear medicine, and it's more like, instead of radioisotopes, it's more like I suppositopes. I suppose it could be this, and I suppose it could be that. So therefore, bone scans are sensitive. Negative bone scan, no osteo. MRIs are equally sensitive but very specific. Oh, that MRI shows osteo. You really, really got it. Bone scans look a little like the Shroud of Turin, little black dots on a white background. It's hard to be specific. But the most accurate test is a biopsy, the radiologic test. This is a HIDA scan. A HIDA scan? What are we hiding from? No, not a hider. A HIDA. A HIDA scan is for looking for cholecystitis. If you have cholecystitis, the bile system, this is the left and right hepatic duct. Here's I'm putting my gallbladder very close here. If you have inflammation of the gallbladder, the duct will be obstructed, and the isotope won't make it into the gallbladder. So the radioisotope won't make it into the gallbladder. A positive test means no visualization. I did not see the gallbladder. Because the cystic duct, the duct going into the cyst, the gallbladder, coli, cyst. The cystic duct is swollen shut, so it didn't go in. A positive is no visualization. No visualization means I got cholecystitis. Hup! I don't have swelling of the cystic duct, and the radioisotope did go in and fill the gallbladder. I have visualization. A negative test means yes visualization because it filled with the radioisotope. When you see this test, you'll see that the gallbladder, when it fills, it's showing you that there is visualization of the gallbladder. Here we have the Shroud of Turin. Is it real? Should we do carbon dating? No, it's a bone scan. Now you know why bone scans may be good if they're negative, but they're not very good if they're positive. Oh, let's look at over here. Look at that leg, the lower extremity. Why, look over here. Look how detailed. Muscles, tendons, bone. This is the white stuff here is the skin and soft tissue. This is the fat in the layer of your leg. What about this thing? Get out my opera glasses. I can barely see that. Well, that little dot there might be an abnormality, but it's very hard to tell if it's in the skin or if it's in the bone. It's natural to pick up at the sites of the epiphyses because that's where the bone cells are most actively growing. Technetium pyrophosphate is laid down by osteoblasts. A negative bone scan means no osteo. This is a bone scan. Negatives are good, positives are not specific. This is a gallium scan. And the gallium scan, which picks up a lot normally in the liver, the gallium scan is useful for excluding fever of occult origin, fever of unknown origin. A gallium scan is useful for looking at the causes of fever and saying, where is it from? It follows iron metabolism, and that's why it ends up lighting up a lot in the liver, because the liver has a lot to do with our normal iron metabolism. A negative gallium means no occult infection. A positive gallium could be either an infection or certain forms of cancer. I have a fever of unknown origin. I did a urine culture, I did a blood culture, did a chest x-ray. Man, I don't know where it is. Gallium scanning can be used to detect a fever of unknown origin because where there's increased infection, there's increased iron metabolism, and it picks up and lights up there. The problem is that it's more specific if it's negative. It's good if it's negative, no infection. If it's positive, you have to do a CAT scan to follow up. Now, most of the things that you're going to need for radiology are a few simple chest and bone x-rays, rarely an abdominal x-ray, and common things. The point of this section was to get you familiar with all the things that you've heard about in all the other different sections and to use this as a review. The point of these images also is so that you will at least have seen it, and this will help your visualization and understanding of other diseases. So even though you could talk about gallium scanning and bone scanning and MRIs, it is better for you to have seen it, and then you will understand for yourself. I will see you in the next tape. I send out from New York City to people I have never met my good wishes and my love for all of you. And you might say, how could this guy be doing this? He hasn't even met me. And I say, it doesn't matter. I wish you well, and I send you my greetings from New York City to wherever you are. Walt Whitman says at the end of Song of Myself, if you want me again, look for me under your boot soles. Failing to fetch me at first, do not be discouraged. Looking one place, search another. I stop somewhere waiting for you.